You probably think all teeth whitening treatments are basically the same, but that's far from the truth. Hi, I'm Larry Dougherty, and I've been a dentist for 17 years, 15 of them right here in San Antonio. I've seen a lot of myths about whitening, and some of them might surprise you. So if you've ever been told your teeth are too stained, or that whitening won't work for you, you'll want to stick around. Because in this video, I'm sharing 7 mind-blowing facts about KoR Whitening that could completely change the way you think about getting a brighter smile. Now, when I talk about whitening, I can't help but talk about KoR because it's the best product on the market. I've used the system so many times, I've got the technique down, and I'm a big fan. But let me be perfectly clear. I'm not a pitch man for KoR, and they don't pay me anything or compensate me in any way. If their product starts to slip, I'll quit using it. And if something better comes along, I'll evaluate it and master it for the benefit of my patients. Integrity is absolutely everything to me, and I'm not married to any brand. I just want what's best for my patients. Powerful treatment. Now, let's start with fact 1. And this might explain why so many people feel like whitening just doesn't work for them. A lot of popular treatments only lighten surface level stains, which is why you see results at first, but just a few weeks later, or days later, you're back to square one. And that's where KoR really stands out. Its bleaching agents are designed to go deep in the enamel and break down even the most stubborn stains. You know, the kind that other whitening systems just leave behind. So if you've ever tried other whitening procedures before and felt like it didn't really do much, here's what you need to do. Ask your dentist, what type of stains do I have? Do they affect the way whitening treatments work? And if they say yes, request a KoR consultation. During your session, be sure to bring before and after photos from your previous whitening procedures so your dentist can figure out exactly where you're coming from. Not only that, but by seeing your dental history, they can set realistic expectations so you actually know what you're getting into. And that's why we encourage you to book a consultation with us. It'll be a quick, no-pressure discussion where we take a look at your teeth, talk about your concerns, and explore solutions. So if you want to get started right away, just click the link below and schedule an appointment. Eliminate antibiotic stains. Now some of you might be thinking, yeah, but my stains are different. Nothing's ever worked for me. Sound familiar? Well, that's probably because you're dealing with the toughest kind of stains out there. It's called an antibiotic stain. So what is it? And can KoR actually help with that? Okay, so antibiotic stains are those gray or brown bands that you see on your teeth. They're usually caused by medications like tetracycline, which you might have taken when you were younger. And while it does seem impossible to get rid of, KoR can actually help with that. It's one of the few whitening systems strong enough to tackle this type of deep discoloration. Let me tell you something. I once had a patient who spent years hiding their smile because no whitening strip, gel, or light ever worked. Then, after consulting with me, we decided to try KoR, and the difference was like night and day. But what if you can't tell the difference between antibiotic stains and regular stains? It's simple. All you have to do is this. First, check your teeth in natural light. If you notice gray, brown, or yellow bands that look like they're part of the tooth itself, that's a sign they could be an antibiotic-related stain. But if you're still not sure, bring some of your old photos to your dentist. This can help them identify what has or hasn't changed with your tooth color over time. Plus, they can assess whether KoR is the best solution for you. No sensitivity. But wait, powerful whitening usually means painful sensitivity, right? Well, that's what most patients think, and I understand where they're coming from. A lot of people skip whitening altogether because they're worried about that sharp, zappy pain or that ice cream headache feeling. But KoR has built-in desensitizing agents that protect your teeth before, during, and even after the whitening process. So you can get the dramatic results you want, all without the discomfort. And here's how it does that. First, it prepares your teeth. So before the whitening process even starts, KoR uses a special desensitizing gel to seal off the microscopic tubules in your teeth. These are what trigger sensitivity. Then, it controls the entire process. And what I mean by that is this. Instead of blasting your teeth with one extremely high dose, KoR uses a low concentration over several days. That way, your teeth have time to whiten deeply without getting shocked. Next, it protects your gums. The custom trays keep whitening gel exactly where it's supposed to be, so it never irritates your gums, which is another common cause of sensitivity. And finally, KoR keeps working even after the treatment. So once you're done with the entire procedure, the desensitizer continues to protect your teeth so you can still enjoy your favorite cold drinks and desserts without wincing. No one's too old for this treatment. Now, who's qualified for this treatment? Because you might be of a certain age and think, oh, I'm too old for this, or it's too late to get my teeth whitened. I hear this all the time, especially from patients who are 50, 60, even 80 years old. And the truth is, it's never too late. KoR works beautifully on teeth as young as 14 years old, but I've seen it give incredible results to patients well into their golden years. Yes, even 90-year-olds. But the only thing is, depending on your age, the process and the results can vary. You see, younger patients usually see faster, more dramatic results because their enamel has less stain in it. It's been around less years. Older patients, on the other hand, can absolutely get amazing results too, but they might need a slightly longer or adjusted treatment plan to achieve the natural whiteness and healthy brightness they want. What to expect. And speaking of results, let's talk about what you can expect from this treatment. Because let's be honest, that's what everyone wants to know. So imagine a patient who loves drinking coffee, she drinks it every day, and eventually she develops deep stains on her teeth. She begins to be more self-conscious about it, so she covers her mouth when she laughs and avoids any close-up photos. Finally, after exploring her options, she decides to take the leap and try KoR Whitening. After a couple of sessions, she couldn't believe her eyes. Her teeth were 10 shades whiter, and the stain she thought was permanent, gone. So, if you're thinking of getting this exact same treatment to achieve a naturally whiter and brighter smile, here's how you can prep for it. Step 1, ask your dentist what shade range is doable for you, because again, it's a case-to-case basis. So even though one patient go 10 shades lighter, it might not be the same for you. Step 2, take a pre-treatment photo so you can see the progress as it happens. That way, you can gauge how much lighter your teeth have gotten over time. At our practice, these photos are a standard part of our protocol. We take so many photos, we actually have a photo studio in our office, and that's where I'm actually sitting right now. Step 3, follow the full at-home protocol consistently, which I'll talk more about later on. The results are essentially permanent. Alright, so now you've got this incredible new smile. The big question is, how long did it actually last? Well, unlike other quick fix whitening kits that fade after just a couple of months, the results of KoR can virtually be permanent, as long as you follow the full treatment and aftercare plan. And that's the key difference. KoR isn't a temporary cosmetic fix. It's a long-term investment with lasting results. So how does it work? Simply put, the whitening gel releases oxygen that your teeth absorb. It then travels deep into your enamel and breaks apart the stains from the inside out. Then, once those deep stains are gone, they're gone for good. All you need to do is follow your dentist's aftercare instructions, which include wearing your maintenance trays often, brushing and flossing correctly, and being mindful of what you eat and drink. Maintenance. But besides those, what are other things you can do on your day-to-day that will actually contribute to long-lasting results? Let me tell you. Your teeth are kind of like a guitar. Once you've fine-tuned it to sound just the way you like, you can't just keep it that way forever. Every now and then, you gotta put in some extra effort to keep it in tune. Quick strum, little adjustment, and suddenly it's back to sounding perfect, and you can rock out like a star. Well, your smile works the same way. Little habits go a long way in keeping the new smile looking just as bright years from now. And what habits am I talking about? They're simple things, but they make a whole lot of difference. For instance, when you're drinking coffee, tea, or soda, use a straw to keep liquid off your teeth. Then, after eating or drinking anything that might stain, like saucy meals or berries, rinse your mouth with water right away. And another thing, keep a fluoride toothpaste handy in case you need quick touch-ups between brushes. If you don't know which brand to go for, I recommend checking out my Amazon store. Lastly, don't skip your professional cleanings every 6 months. This will help keep everything looking fresh and detect early signs of problems before they get worse. But before booking anything, here's something you'll want to think about. Do you even need KoR Whitening in the first place? That's exactly what I break down in this next video, so you can find out if this treatment is truly the right fit for your smile. So click on the video on the screen to start watching.